When I think of recovery from an operation, I think the patient getting back to their lives, not just making it off the operating room table, and it takes a team to do that.
The Cardiac Advantage at St. Joe's is a multidisciplinary approach to patient care, which entails the skills of varying specialties working together, not only at the communication level, but on the patient in the procedure rooms.
At St. Joe's, in the Michigan Heart and Vascular Institute, we have nearly 50 physicians that are specializing in cardiovascular medicine, surgery, procedures, and images. This is a single vascular surgery group, a single cardiology group, a single interventional radiology group, a single cardiac surgical group. And so I think what's unusual is that we work as a unit.
We have been together as specialty groups since 1988. And so the Cardiac Advantage that is here at St. Joe's is based on a long history of collaboration. There are many institutions across the country that are trying to put together a program like this, but the interdisciplinary collaboration is not something you can dictate or mandate. It's built on the personalities and the qualifications of the individual specialties.
With the Cardiac Advantage, the patients are seen expeditiously across the board for all the specialties. The fact that we do have digitized radiography and EMR, it's pretty easy to get multiple opinions for one patient immediately. It's not only getting in to see a physician early, it's getting multiple opinions at the same time.
Each specialty brings a certain piece to the table, and those specialties together will decide what the very best way to treat this patient is, rather than using a balloon 5 times to make sure that we've really tried everything before you'd ever let a surgeon get involved, or rather than a surgeon saying, well, I know how to do the operation, so I'll do the operation even if maybe a balloon angioplasty is a better treatment.
Yeah, there was a patient that was seen by one of my colleagues who's a cardiologist who was noted to have an aneurysm in their pelvis. So when we scheduled the patient to have the procedure, the cardiologist and myself performed the procedure together, and Dr. Whitehouse was aware of the patient and was on standby in case there was any complications that occurred. So I think that's a very unique thing that you're not going to see at any other place, or very limited places where you have specialists from 2 different disciplines performing procedures on patients at the same time, using the skills of each other to help improve patient care.
FFR was 0.73.
We're going to go ahead and intervene.
The collaboration occurs on a daily basis in cardiovascular medicine. For example, a routine catheterization, if the anatomy is appropriate, will be reviewed by both the surgeon and a cardiologist. And the best course of therapy will be determined, typically both of us sitting at a monitor, reviewing the films together, and deciding if the patient is best served with surgery or with angioplasty and stenting. That occurs multiple times every day.
The technology that we depend upon every day here at St. Joe's is at the highest level. And the people interpreting the studies that are created by the technology are also trained at the highest level.
We get to work in what I consider to be state-of-the-art operating rooms. We have a new operative tower that's opened recently, and it's been fitted with the most recent technology. From a cardiac surgery standpoint, we have robotic technology available to us, and all current technology that lets us perform complicated operations well.
Good morning, Preston.
Good morning.
How are you doing today?
The vibrant, energetic folks that are here at St. Joe's caring for the patients after procedures are amazingly talented. It's a whole healthcare team that's devoted to the care of these cardiovascular patients, and it includes advanced practice nurses, technologists that help us with the imaging procedures and the invasive procedures. It's nurses on the floor that are dedicated to the care and education and nurturing of the patients that are here. It's that kind of level of care that allows the primary care physician to know that the right thing is going to be done for the right patient and at the right time.
The Cardiac Advantage, St. Joseph Mercy Health System. Remarkable medicine, remarkable care.